So we're really looking at test item writing as both art and science, and I think my inspiration around that comes from the fact that there's so many things in education that combine both. So I'm going to try today to give you a little bit of the underpinning from the scientific side that will really help guide your test analysis, which leads to better test item writing ultimately, because you can use the statistical information you receive from your test administrations to help you pinpoint where problems might have arisen in your test items and how they're constructed. But naturally, the art comes from your ability to really translate through that test content so that you can create a situation that for the test taker puts them in the middle of a clinical situation. And we find that most of the items that are extremely successful in use on any type of test or evaluation assessment, whatever you might call it, those are the kinds of things that come out of your clinical experience. So we'll try to make the most of both the art and science as part of this process. I do want to give a nod to the National Council. Obviously, the National Council of State Boards of Nursing, the author of the NCLEX, really is the one of the main sources for information, resources for developing critical thinking type items for use in nursing programs. And I would direct you, I've got that source note down there, go to their website and explore what they have to say about processes that they use for development of items. Not that every school obviously can emulate what the National Council can do with their vast numbers of items, their ability to analyze through some very sophisticated means. But the approach and the way that they structure the NCLEX are going to be important, because obviously that's going to be something that you've got to prepare your students for throughout the program, is their ability to manage the questions successfully that they're going to encounter on the licensure exam. And indeed, there are sources of information that are very, very rich for you in developing your curriculum when you look at how the tests can go beyond just shedding light on what's going on with the individual student. Clearly, there are roles for internal and external curriculum evaluation. There's an ability to track your achievement of learning outcomes, the student-centered outcomes that are so important, and those that you're going to be dwelling on when you're working through your self-study for a reaffirmation of accreditation or maybe your initial accreditation process. If you look at external evaluation, comparing the group at your school with the population at large, sources for that include standardized exams. There's many of these that are available today, and clearly the licensure exam. But what we're really going to be looking at in our discussion about test item writing today would be internal evaluation sources, evaluation of your course objectives, your learning outcomes, and those are really accomplished through some strategic item writing, the tips that we'll give for that today, through conducting regular item analysis and using consistent standards when conducting your item analysis, and then banking information, not just the test item itself, banking the exams that you prepared, and banking the items along with their statistical analysis. There's a 5-step process in the sense of all of these pieces not necessarily coming together in a 1, 2, 3, 4 type ordering, but they need to be present when you're developing critical thinking exams. You've got to have some basic tools, and we'll talk about those. You have to intentionally write at the application above level on the cognitive taxonomy, and we'll talk about that. It's very important for some of the, what I call housekeeping duties that we'll look at, but things like form and style need to be present, and they need to be consistent so that the exam process that students encounter as they work through the curriculum doesn't have so many vastly different components to it. And then, of course, there needs to be a scientific analysis that happens every time an exam is given, and that will impact the entire assessment process used in the school, but it will have far-reaching consequences as well once that information is used to evaluate the curriculum. which should be occurring as a portion of everyone's total program evaluation process. So the place to begin always begins with our instruction, and this little mechanism shows from a model perspective how each of these areas will feed the next. So essentially, once the program outcomes have been envisioned, the objectives for each course will flow from there. Instruction needs to reflect how those objectives are to be met and should reflect a lot of activity. As we know, not anymore will instruction simply be a passive process, but a lot of activity that mirrors what the students being asked to do in the clinical setting where they have to apply their knowledge. We have several evaluation mechanisms always at play, one of those being the teacher-made test that the students will take throughout the curriculum, and those should be the measure of whether the outcomes have been achieved. So this little circle image will function throughout every program for the better and for the worse, depending on where the strengths and weaknesses are in each of these areas. But the educator's golden triangle would be the area where all of these pieces begin to talk to each other so that they all function together for the purpose of the supreme goal of having good instruction for your students so that you can indeed achieve good outcomes and they can be functioning in their professional roles. Here's a little bit of a breakdown on that triangle. Each of these areas flow one to the other, and for some people they're always curious about the fact that I have evaluation tools as the biggest component. In some cases, philosophy, objectives, and outcomes would be this foundational piece. But instead, I see that a lot of what happens with the evaluation tools and the quality of those is directly responsible for the functioning of these other two areas. So if you dig through the literature and really come up with a definition for critical thinking, you really find that this is a process of analyzing and understanding how and why we've reached conclusions. And that's what tends to separate the questions that are written on exams, not for the purpose of recall of basic facts, but indeed for the purpose of analyzing how the facts will fit together and how they can be used to take some kind of action. When you do that process, you're really living in this cognitive taxonomy. You're moving up to the higher levels of the taxonomy when the students begin applying, analyzing, and evaluating as part of the process of completing any of the exams that you're giving. So the greater proportion of test items really needs to be happening at this upper portion of the taxonomy. The sad thing that I find in many of the venues where I'm consulting with faculties and with others in the educational process is that many of our tests still reflect a predominance of the remembering and understanding component, or from the classic Bloom's, the knowledge and comprehension piece. That is simply a recall-based process, and it doesn't really get at the student's ability to critically think. In other words, to actually conduct that analysis and take some kind of action. So how can we improve this process and really create a test that's composed of test items that are functioning at that application and above level here? Well, the quickest way is to assemble your tools. So remember, one of the components that I told you, one of the 5 things you need is to assemble a set of tools that you can use that will consistently help you analyze your test items and how well the test items are performing. A lot of times I think that faculty envision the test as a way of eliciting what their student can do. What is their student's performance? How competent is their student? And this is indeed true, but I believe that it's important for you to look at your test instrument as something that also needs to have properties that will become more and more effective as you perfect the test. So the test needs to be working for you just as hard as you work for your students. So that means your test can't be full of questions that really don't reveal a whole lot of detail about the student's thinking process. their ability to think through a clinical problem, and their ability to identify the correct action that they should be taking. So if your test is littered with recall type questions at that lower level of the taxonomy, then you're really working with a test that's not working for you. So the goal here with a lot of the item writing tips of the trade is to improve the items on the test so that you get a better test instrument. One of the things we do consistently is a post-exam item analysis. Every time you do a test, you've got to be able to come back in as the Monday morning quarterback and look at the film. So using that analogy from sports, you've got to come back, look at your highlight reel as well as lowlights for what happened with that test and how it was administered and delivered. The way that we do this most commonly is through the statistical analysis. And I'm not going to dwell on a lot of this information in this particular webinar. My intent is to delve into the statistical analysis in more detail in a future webinar. So I'll ask you to trust me on these standards, and I will give you some of the underpinning for those when we talk about the whole psychometric side of test analysis in more detail. But you've got to have an index of reliability. You need some type of measure of reliability that tells you that your test is going to provide you with consistent scores. And the most common way that we see this expressed is with the KR20. This particular formula is most commonly used, and it's a statistic that you can retrieve from the ExamSoft applications in order to really have a reliability index for your test. In combination, you need another statistic, the point by serial correlation coefficient, or the PBCC, to help you examine the test items and their relationship to each other. The good news about these, if you notice the range here from a -1 to a +1, as long as you can count to 1, you can do these statistics. So we'll work on that in a future webinar. Here's the standards that I'll ask you to just trust me at the moment for acceptance. These are widely publicized in the psychometric literature, and you'll see it in nursing education as well. An item difficulty, in other words, computed off how many of the students are actually able to answer the question correctly versus those that answer it incorrectly. That range needs to be between 30 and 90%. Specifically, below 30%, the item is too difficult. Above 90%, it approaches being too easy, unless you have a mastery concern, which is a separate type of concern related to item difficulty calculation. An item discrimination ratio will give you a rough approximation of student performance on an item. In other words, same kind of thing that the PBCC will do. Are the students who are performing well on the test as a whole also performing well on this particular item that's under analysis? Or are students who are not performing well throughout the test suddenly doing a great job with a particular item? That gives you a clue that there may be something going on with that item that you don't necessarily intend, and there needs to be some editing. The KR20 of 0.7 and above, that's the goal that you're trying to achieve for the reliability of the entire exam. In nursing, these standards are typically a little bit different, and that really is because of the fact that by the time the students are in your nursing program, many of them at the upper division of their major, there's really not a lot of variance in the population of nursing students. Their curriculum is very much the same. If you think about how they compare to other kinds of majors, nursing's got a very homogeneous population of students by the time they're approaching their final year, and certainly in their final semester of the program. So for that reason, we don't see as much variance necessarily, and that will somewhat impact the point by serial standards that I would recommend and the reliability, but not by much. You still have to have a very reliable exam. You need a consistent method for reviewing these statistics, and this would be the method that I would recommend that everyone follow. You've got to start with your item analysis process when you're looking at your exam on that Monday morning quarterbacking view. What was the difficulty level across the entire exam? What's the difficulty level of each of the items? And remember, this information will vary based on the performance of the class at hand, but you should be looking ahead down the road to your ability to track this information cumulatively so that you're not making decisions about the value of a particular test item based on the performance of just a small group of students. You really need to have that bigger view across multiple groups of students that have taken this particular test question over time. So reviewing the difficulty level is the first step. Looking at the discrimination data that you have at hand, either the IDR or the point by serial, would be the next important step to determine if you've got items that are indeed helping you determine which students really know their stuff and which ones do not have a good handle on the material at all. And then the response frequencies, I think, are going to be those that are very revealing. And these are the ones that I find are very helpful in the process of item writing because they can help focus where a particular issue might be with a question. So for many of you, you may have been struck by the fact that you really had some poor item analysis results maybe across your last test, and it might be almost overwhelming to think about how many test items probably need to have some rewriting done. Well, what I'd encourage you to do is approach this with, is there a way that you can process through what's going on with your item analysis and drill down to the areas that really need your attention? The truth is you may not have to completely rewrite every aspect of the question. It may be that there's a problem with one of the options and you have a distractor that's not very plausible, or one of your answer options is really being eliminated by students both at the top of the class and those at the bottom. And if that's going on, I take you back to that concept of the test is not working for you then. The purpose of your test is to help you discriminate or identify those students that really know their stuff as compared to those that really don't. And if you're really seeing the same kind of performance on a particular set of options on a question, with some of those frequent responses, no one in the class even choosing, that tells you that you've got to do some more work on your particular answer options. And that may be what's needed to put the question back out, trial it again with the next group, and see if you don't see some improvement in the overall statistical analysis for that question. Storing this information is extremely important. And that's, again, back to assembling the basics and having your tools. You really need to have a system that will allow you to accumulate the information, accumulate the data, so that you're not making decisions based on one small group's approach to the test. As we know, there are situations that can happen with particular student groups, with things that are happening in a particular semester that might really skew the performance one way or the other, and you wouldn't want to be caught in a situation where you're making decisions about test items really not being sufficiently robust enough or performing well enough on your test so that you get the idea that you want to just throw them out of your bank. If you look at the cumulative data, you'll get a much more well-rounded opinion of that item based on the facts, based on the item analysis data that comes not from just one administration of an exam, but across multiple administrations. So here's an example of how you can pull cumulative data together in some of the ExamSoft screens. And I really like the fact that these response frequencies that we were just talking about a minute ago pop up in a way that you can quickly identify, look, there's problems with this question. There's nobody choosing distractor D or distractor E. That's a red flag right there. We need to start working on that. But as you accumulate this information and perhaps you track it, and we'll look at scoring categories, ways that you can track the information, you get a much better handle on how the individual test items perform over time across groups and truly longitudinally. The other piece that's important as part of your data storage concern in your item bank is that you've got some evidence of content validity with your exam, as well as the evidence of reliability and other types of psychometric measures that you're taking care to store in a cumulative fashion for all of your items in your bank. When we talk about validity, the test needs to measure what it claims to measure. And the way that you can demonstrate that that's occurring is that your test blueprint needs to be on file, and your item discrimination data from your statistical analysis needs to be on file. Test blueprints have evolved. It's no longer really acceptable to simply make a faculty-generated blueprint, which typically is the classic topical outline for the test, the number of test items that are selected from each topic, even when those are approximated against the amount of time that was spent in class or perhaps in clinical or other settings on that topic. What's really necessary at this point in time is the electronically generated blueprint, because there's so much more rich data that can be incorporated into the test blueprint when the computer pulls it all together from the available information that's stored in the item bank. So in this kind of example, there's a nursing process component here as part of an exam blueprint that the computer is actually able to generate and tell the instructor as the test is being compiled and put together how much of the test is reflecting assessment. Well, at this point in time, this test has 9.09% of questions that have been categorized as assessment as part of the nursing process reflected. If you have a curriculum that's been built with a very specific type of objective, that assessment is a component that will be defined always as reflected in 10% of every instrument that's used. So every test, every clinical experience, there'll be 10% allocation for assessment. Then this test has got to be improved on. It doesn't have the requisite percentage of exam that's been set up as part of the standards. And you can see what a valuable tool this might be at the point where you are doing a full total program evaluation. If you've ever been asked to demonstrate how do you test assessment throughout the curriculum, this blueprint would give one very clear objective example of how assessment might be woven in at a specific level across the entire set of courses in the curriculum. So I can't emphasize enough how important it is to have electronic blueprints for each of your exams that are available, that are compiled in the computerized software application, so that you've got the level of detail that you need. The categories that are suggested here, the ones that I've illustrated, are all part of the suggested category list that ExamSoft already has pre-configured as options for setting up categories to tag items in the item bank. So this work's already done. You simply have to choose the appropriate categories that reflect your learning objectives and, of course, your total program evaluation plan. The other thing I would emphasize is that if you are really focused on incorporating the NCLEX client needs as important categories within your teacher-made test, just as they appear on the NCLEX, you need to be aware of the alterations that have happened between 2011 and the current 2014 test plan for this exam. So I would refer you back to the National Council's website for more information on the test plan. But in those intervening years, an example of safe, effective care environment, the coordinated care piece has increased, while the safety and infection control overall has slightly decreased in this range of potential items from that category. On the other hand, you're not building an NCLEX style test at the end of every one of your courses. So what you may want to do is look towards progress as you get students through your curriculum, they get close to the end of program. Are you effectively incorporating these categories, and in what type of percentage are you reflecting them across your teacher-made tests as the students get to the end of the higher level of the program. Critical thinking test items are always going to be composed of some of the components here that need to be consistently present. So there should always be a rationale. Whether the students are allowed to view that or not is really at the decision of the faculty. But it's been very, very clear over the years as more information has been gleaned through research into student remediation based on areas that they've reviewed on their own assessment outcomes, that they've looked at their own test scores, that understanding the reason behind the answer that was the correct answer in the selection versus the answers that were not considered as correct answers is very helpful to students in putting that critical thinking process together for them. They can learn from that rationale. The downside to it is that there's been such attention to these in terms of recognizing that test security comes into play when the viewing of rationales is offered. If students have too much familiarity with the test item, the correct and incorrect answers, and are using that information rather than as the learning experience, but instead to reverse engineer the test, so to speak, then that's not an appropriate use of the rationale viewing. And in some cases, faculty are indeed justified for removing the rationales from view. I would state, though, that for the test item writer, construction of the rationale very often leads to improvement in the item. And there's been multiple times when I've written an item that in my mind I thought it was really a strong item. By the time I got through with taking that extra step of writing my own explanation, not a bunch of pages out of some textbook, but the own explanation that I have from my clinical experience, as well as my understanding of the content that's reflected across all of the major content in nursing and standards, what would happen with that is the rationale would show me, gee, there's really another level that I can push forward with this question. I've been complacent to leave it maybe at the comprehension level when I could push it further and make it more of an application item. Or I could take an application item and really dig for deeper analysis. And if I had not taken the time to write that rationale, I really would never have experienced that particular process. So I think it makes you a better item writer when you incorporate the discipline of writing your rationales, justifying the correct answer versus the incorrect, certainly for yourself, and then ultimately perhaps for students if they're actually going to view that information. The other thing that comes out of this is that writing items at the application level or above is absolutely a must. And I'll go ahead and talk about the remaining two components of a critical thinking test item, and then we'll go into these in more detail. You have to require students to think in a multilogical way across multiple facts, content pieces, putting pieces together in order to really effectively answer a critically thinking type question. And finally, you have to ask for a level of discrimination that goes beyond the obvious, of course, where students really have to think very carefully, because there are not only black and white answers, as we well know, in nursing problems. They're going to have to think through the gray areas, and they're going to have to see that there is indeed something beyond their first, sometimes just their first glance at a question that they need to process through. So these four areas, I would encourage you to commit to memory to some extent, so that every time you're writing a test item and you're striving to make sure that it's really looking for students' critical thinking abilities, that you've got these components represented, that you've done a good job with including a rationale, you've written that, you've made the question certainly at the higher end of the taxonomy, you can literally see multiple facts involved, you can identify the multilogical type of thinking that's required to answer, and you've certainly asked for high levels of discrimination. So how do you do all of this? Well, the rationales, as I mentioned, can have multiple forms and fashions, and you can use them in several different ways. The most common way is to provide the students with an individual experience in reviewing rationales at the conclusion of their exam while they're still under proctored conditions. One of the things I find with that is that it does enhance security of your item bank to only allow this experience while the students are still being proctored and they have no access to any devices that would allow them to carry content outside of the testing environment. It's very, very important. But it does answer the students' immediate need for some feedback. They may not know exactly or remember exactly how they answered every question on the test, but they'll get a feel for whether they were in sync with what these right answers are versus not. That buys you some time for a very faculty-friendly intervention that I've talked about when we've set up things like policies and test committees that review policies surrounding testing in your program. This kind of test review situation can in some cases be very faculty unfriendly when the test is passed back out to the students or the students are brought back in a non-proctored formal setting, and it becomes a standoff between students and faculty. That's not a productive test review, and I really don't support that kind of process in any way. But if the students have had the opportunity to have their individual review of rationales, not as a group, but so that they could recall what they had done throughout the exam and then leave it at that, the faculty has the opportunity then to not release the grades until they've had the chance to do the full item analysis on the exam to make all the grading related decisions that they need to make. And that's a much more friendly environment overall and more constructive environment overall. And finally, the rationales do add some legal defensibility to the exam. You're able to reference things like standards. You may indeed want to reference some particular content from a textbook source as one of the components that leads up to the effective answering of the question. So there's a lot of good reasons to include rationales as part of your item writing. When you write questions at the application level and above, you are instantly promoting their thinking about a clinical problem. So that means that if you're asking them for one particular fact, you're not writing at the application and above level. If indeed students are thinking about clinical problems, it does indeed change the way that you're teaching. And there is a real push for the interactive classroom. There's no real place for a passive classroom in preparing students for questions that are written at the application level and above. They have to work with these questions and think of them in terms of the actual clinical problems that they were intended to reflect. For multilogical thinking, I think the important piece here is that students have to know more than one fact in order to answer the question. If your question, as you're reviewing it and you're writing the rationale, doesn't meet that standard, you'll know it probably right away, because the classic I can find this answer on a single page in a textbook type of mentality about the question totally defeats multilogical thinking. You shouldn't be able to find the answer to your question on your exam on a single page in a single textbook. If this question really reflects clinical practice and problem solving of a clinical problem, then there's going to be a multitude of various facts and observations, subjective and objective data that the student will have to pull together in order to effectively answer the question. And finally, the highly discriminating component. Questions really have to have viable alternatives presented as answer choices. If the answer choices are resulting in those response frequencies that I showed you earlier, where nobody's picking D, and nobody's picking E, there's a problem there, because that means that you don't have a real set of highly discriminating options, and it makes it, frankly, much easier. Students are able to rule out a whole host of your options. How easy then does it become for them to answer that question correctly? So be sure that you have highly discriminating, very plausible options that you include. This is tough. Most of us, my years of item writing, obviously you start with the correct answer that you have in mind, and you can usually figure out almost immediately an answer that's not correct. But where it gets tough is trying to come up with the other two or the other three that really are very close in comparison to both the correct answer and maybe even the one that was not correct that you originally envisioned. That's really hard to do. Sometimes it's really good to work with a couple of colleagues who are teaching perhaps in the same course that are thinking about the same material, and they'll be able to help you with those kinds of things as you pass the editing of a particular test question back and forth between you. And then lastly, I would say that one of the things you can do to promote your critically thinking test item writing skill is to be sure that you have these types of questions at the end of your STEM. Your STEM needs to be as succinct in its wording as possible. This is not the time for you to practice your creative writing skills and start writing the next best-selling novel in America. It doesn't need to happen in your STEM. You should have succinct information there, and then as many times as possible, truly 99 out of 100 times, you should end the STEM with a question. That's the purpose of the test item, is to ask the student a question and to pose for them some kind of active involvement that they should be taking as a result of reviewing the item you've presented in the STEM. So they have to make a judgment. Which intervention is most important? Which should be done first? What is the best response? And I've had faculty over the years that have said, well, I really can't ask them a question about which response is best. My reply is, why not? You're the expert. You know what this is supposed to be looking like based on standards, based on your knowledge, in your rationale. That's where you defend your position in terms of why the correct answer is correct and all the other answers are not correct. So be sure that you have intentionally moved into a STEM that's succinct, that does provide the information that's necessary to then answer this all-important question that should end your STEM, that's along these same lines. What action should the nurse take first? Which intervention, which plan, which nursing action has the highest priority? The good news about this is that you can shift the environment, you can shift the patient population, you can shift the different disease modalities. There's lots of different things that you can move around in the STEM to best meet your objectives, but you're asking the student to think about what they need to do in a very similar way, and that's how you get a consistent read on how effective they are in problem solving and in managing clinical problems. I would say don't forget that there are alternative test item formats out there that the National Council has been using for many years on the NCLEX. And the good news is that a system such as the one that ExamSoft would have would incorporate many of these alternative item types. Now, I don't believe that the students' teacher-made exam should be the only place that they get experience with these alternative test item formats. There's a lot of different practice tools. There are a lot of different homework assignments, and there are a lot of classroom activities that you can build around exposing them to these alternative test item formats. But you do need to have representation of these on your teacher-made exams. Remember back to that defensible test. If you're making clear that your student learning objectives in your course and the student outcomes for learning in your program are part of an intentional plan to prepare the students for the licensure exam, then you need to show evidence that you're exposing students to the kinds of things they're going to see on the licensure exam as they matriculate through your program. And don't forget that there's constant innovation going on with the NCLEX. For example, just in the last year, There's been an incorporation of SI units in some of the questions that focus on laboratory values. So you may want, again, to think about exposing your students to these. Obviously, it may not be in use in your hospital facility in the United States, but as the NCLEX becomes more international, there's going to be these kinds of units of measure and other kinds of things that will reflect that more international and global perspective. And your students shouldn't be thrown off by that. They should be able to recognize that, indeed, while they may be focused on imperial measures, they've already had to deal with metric, and SI units are just another component that they need to be familiar with. The other thing that's transpired, of course, is this move away from the trade names for medications being embedded in questions. There's references now primarily to general classifications of medications, but in most cases, generic names only are used on the NCLEX, and that should be the path that you're taking with your item bank as well. So just moving into some of the item writing rules that can help you in processing through your ability to create critically thinking style items. Some of these may be seen as preferences, and that's why I'll have a little piece in here about how a testing committee can really help with creation of the rules. I mean, let's face it, faculty like rules. We like rules. That's why we like to be in school. So we can adhere to some of these style guidelines fairly easily. I think the bigger picture is that you can't stop improving your item writing just because you're really good at following the rules. Instead, you need to start asking, what are we doing across the program? Are we still seeing inconsistencies in style in one course where tests are given as opposed to another? And what is that telling the student? Are they really getting an ambiguous message when they see too many different incorporations of various styles into their tests along the way? So I think a testing committee can certainly help solve some of this, and the faculty's preferences then can come out in terms of how they would like to see their item bank constructed. One of the classics for me is to get rid of all the names of patients. I think that brings a lot of excess baggage to a question. All of the leading licensure and certification exams have moved away from that many years ago, and they'd use references to the patient or the client instead. Get rid of those multiple questions where the distractors look like a series of alphabets. So the answer might be A, B, and D, and C and E, and A, C, and F, and all that stuff becomes simply a jumble. Those are really considered to be poorly constructed test items. There are some ways that you can salvage those and actually turn them into some of the newer item types, including multiple select perhaps. So in other words, select all that apply. That's another common type. But you shouldn't leave them in their previous form. That's really bad form in terms of questions. Approach a non-sexist writing style as much as possible. And in fact, you need to broaden your perspective across all of healthcare. Those that are offering the prescriptions are not necessarily the physician anymore, the healthcare provider, the primary care provider. And the physician or primary care provider isn't always a he, and it's not always a she if it's a nurse. So really incorporate a much more non-sexist writing style overall. And you've got to get rid of the excess wording. As I mentioned, this is not the time for the great American novel in your STEM. The scenario-based items of the past that required the attachment of multiple questions to a single paragraph have also been greatly removed from most item banks now because the computerized software applications really don't have a structure for those. So each STEM needs to stand alone. You need to get rid of a global scenario that all the questions would pull from. And one of my pet peeves is of the following, which of the following selections or what have you, because of course they're going to follow. They're right next underneath the STEM on the page. So that's just a piece of fluff that needs to be removed from the question. Make sure items can stand alone. and do end your STEM with a question whenever possible. It's very distracting to the student to use one of those completion items where half of the sentence is started in the stem with the ellipsis following, and then there's a set of 4 different answer choices, each with a set of ellipses that lead off. If you can ask a question, you should, and that should be your goal with every stem that you write. Make all of your answer choices plausible. Make them as homogeneous as possible. Now, you can get to the point of being completely obsessively compulsive about their length, so don't go that far with it. But indeed, try to keep these distractors so that one distractor isn't just, a whole line and a half longer than the other. Most of the students now that have done any kind of test prep, test-taking techniques will be looking for flaws in items, as well as acting on that when instead they should be using their knowledge. So don't make it easy for them to use some kind of test trickery to figure out a correct answer when what you really want is to see their knowledge. You want all of the above and none of the above to disappear. You also do not want to include a negatively phrased question, and you'll see a good explanation about that on the National Council site. They've really taken steps to remove exceptions or negative questions, because the purpose of the question is not to determine if the student knows the wrong thing to do, but instead knows what to do that's the correct action to take. Alternatives overlapping is a problem that you face primarily with things like drug dosages and laboratory values. Be sure that there's no overlap, because that will indeed confuse the student if the answer that they envision is the one that happens to be right in the center of the overlap. Vary the correct answer. This would be important if you're not using a testing application of some type on computer, because students will use this as a way of detecting, well, this faculty member usually always has C as the correct answer, so if I don't know what the answer is, I'm going to choose C just because. Very poor reason for selecting an answer. And most importantly, I really would encourage the use of a testing committee to decide what these guidelines are going to be in conversation with the curriculum committee and the student affairs committee, and make some real good, solid, scientifically supported recommendations about policy and procedure. And we do have another webinar that goes into more detail on this, but policies should really encompass everything from writing style, format, how grading is going to be accomplished, how the item reviews are going to be done, how tests are going to be revised, and how that information is going to be tracked longitudinally on individual students and on classes, so that you can get the aggregate results as a whole. Test security is an important part of that policy and decision making about how those tests are going to be given, and there needs to be some very clear vigilance around test security. There's a lot of available structure and features for that in computerized applications like the one that ExamSoft has. So it cannot be stressed enough that not only with standardized testing but with teacher-made testing, there's got to be more and more vigilance around test security. Never stop tweaking. I think the last message that I'd like to leave you thinking about is that a test question is never done. There's no such thing as a test question in a sense that's complete forever. Practice changes, our students change, their preparation varies as we enroll them in our program. And there's always a process of tweaking, and that's that continuation of the review of the item analysis data to look at where your question might be improved with just a small amount of editing. Put it back out there, gather some more item analysis data after you make a particular tweak to maybe one of the answer options and see what happens. The most important things you need to gather, again, are your own knowledge, the production of that test blueprint, and the use of your testing software that will help you keep your cumulative data together. And of course, you are the reason why this all works together. Faculty indeed are the keys. And I encourage you to continue item writing. Don't be discouraged. Do it in small groups. Have a party, whatever it takes for everybody to bring their items that need a little bit more love and attention into a tweaking session. Your time will be very well spent, and you really will reap the rewards, and so will your students. Thank you so much for your attention, and I'll turn this back over to you, Kim.